Hi, everyone. My name is John Faulkner, and I'm your host of the Smarter Systems, Better Care podcast. I'm here today with Dr. Garg of Dynamic Athletes. Thank you for joining us today.
Thanks, John.
And just to give us kind of diving in right away, tell us a bit about your background. How did you get to where you are today?
So I'm a non-surgical sports and regenerative medicine physician. And in the world of sports and orthopedics, there's a really different mentality of steroid injection, physical therapy, and surgery. And I started to notice that more and more that these injuries don't actually require surgery. And so how do we help people stay healthy and active when most of these don't require surgery? And so that's what we developed and established Dynamic Athlete Sports Medicine and Regenerative Orthopedics.
And what's been kind of like your passion, like your drive is it sounds like prevention is like a big passion of yours. Like, where does that come from in your history?
So a lot of it, I grew up playing, I played baseball in college. I played a year after. I've coached. I'm one of the national team doctors for USA Hockey and US Soccer. So I'm around it all the time. And I look at how do I make a bigger impact? And even certainly from the prevention standpoint, as we look at sports performance and mental performance in our office with some of the things that we have, but also when they get hurt, how do we get them back quicker without surgery? And obviously there's times when surgery is needed and indicated, but a lot of the times there's not. And then there's now how to utilize these new technologies or even older technologies to your advantage to be able to get these athletes back quicker. And so we're reducing injury time by almost 50% in some cases. And so
Wow, that's amazing.
huge. If
Yeah.
you think about it, even in a salary cap era, right, where you're able to get your person back, if it's a 3 to 6 week injury and you're able to get them back around that 3 weeks or even sooner, that has huge implications, not only from a professional standpoint, but from other levels that are trying to get back and trying to improve their performance or just even being able to make money, as we have professional triathletes and cyclists and runners who need to be able to race to be able to make an income for themselves.
And as an athlete, why should they care about prevention? I feel like a lot of athletes get kind of stuck in the moment. They're not really thinking about that. They're just like, oh, it won't happen to me, or, and then after that point, it's too late in some cases, right? So
Yeah, I think the big component is how do you look at your health really before and after an injury, right? And so I'll give you an example. We have a professional cyclist who was injured in her hip, and we actually did some pelvic floor work. We have a machine that produces almost 11,000 Kegel exercises at super maximal contractions in 30 minutes, in less than 30 minutes. And so we
wow,
put her
that's
on that
amazing.
series, and we used our shockwave to work on her lower abdominal muscles. And she said she never felt as strong through her pedals. So imagine you're talking about from a prevention standpoint, that's one aspect that we can look at, that if they're doing what we have available in our office prior to them getting hurt, this may allow them to actually avoid injury. By the same token, if they do get hurt, and it may be supplementing or complementing how to strengthen the area around their injury. And so I think there's a big component to it, but a lot of it is looking at how do you handle these injuries both before they happen and certainly after they happen. And I think sometimes even the bigger impact is when they happen, how do you take care of them where the answer isn't always going to surgery, right? I used this example before where my father and my sister, they're cardiologists. And I always say that if you have a heart murmur, do you go see a cardiothoracic surgeon first? And the answer is no. No, of course not. If you have a headache, do you go see a neurosurgeon first? No, that'd be crazy, right? And then I say, well, if you hurt your shoulder, why do you go see an orthopedic surgeon first? And then people are like, well, I don't know. That's a good question. I don't know why, because I don't know if there's another option. This is the other option, right? And I've had the opportunity to work with some of the best orthopedic surgeons in the country. And for me, there's absolutely surgical indications for things where I have to turn people away and say, look, what we do here doesn't work for you. You need to go get surgery. But a lot of times that's not the case. And so I think that's what drives me, John, to be honest, is how do we make a really big impact in the community from a non-surgical and regenerative standpoint?
Yeah, figuring out how you can help the most people is what you're kind of
Correct.
talking about as well, right?
Yeah, if I look at it like if they're in my family, what would I do for them? Right. And I think that's the only way forward. I don't know any other way forward other than if you're part of our family, what are we doing here?
Yeah. And, looking at like your beliefs and values, like, how has that shaped how you worked over the years? And how has that developed and changed?
Yeah, I think the big thing for me is looking at them and trying to figure out above all else what's in their best interest. And really looking at it from that family type approach. Like, this is somebody that we build relationships first and take care of people second at Dynamic Athlete. This is how we function. And so I feel like that if that's the premise and if that's how you are approaching your athletes or your patients, you can sleep well at night. And I think that's really been the biggest thing, is that if you're hunting for what's the diagnosis, why they have it. We talked about this before, where this is almost forensic regenerative medicine or forensic sports medicine. We're trying to reverse engineer how they got hurt. And so that's the drive. When I teach the students and I teach everybody that comes to our clinic, when we have training institutes that people from all over the country, clinicians all over the country fly to our office to learn about how we're doing things and what are we doing that's allowing these people to get back at a 90% clip. Like, our success rate is over 90% in terms of what we do. And sometimes it may not work, but again, if you're doing things for the right reason, I think your outcomes are going to be superior in that space. And so from a value standpoint, that's what drives me. I think, how do we make a huge impact in our community in the best way possible? And it's been super fun to be able to make an impact like that.
And when you're talking to, just people in the real life about what you do, what are the objections that you get from people when you're working with them, and how do you handle those?
Yeah, it's a great question. I mean, I think part of it is the educational component. That's the first objection, because they don't really know about the cutting edge biotechnology that we have in our office, coupled with the PRP and the stem cells. And we use Shockwave, and we talked about the Emsella chair for the pelvic floor. We also have an ExoMind machine that works on mental wellness and sports performance from a mental standpoint. So if you look at those 5 core things, I think the biggest objection is that people think that all PRP, all stem cells, all Shockwave are the same. And that couldn't be further from the truth. And I think that's where people, A, don't know about it. So there's that barrier. And then B, they know about it. They've heard about it, but then they think they're all the same. So then it comes down to, well, if they're all the same, then I'm just going to price shop and then find the cheapest one. It doesn't matter if they have no experience doing it or don't have any background on it or whatever. And then they say it doesn't work. And then it gives it a bad name. Then they say PRP doesn't work for me, or stem cells didn't work for me, or Shockwave didn't work for me. And that's where they come and usually see us, where they said, I've tried everything, this hasn't worked for me. And then I said, well, okay. And then we start going into, well, who did it? How did they do it? What was their protocol before, during, after? And what was your care plan in that sense? And they look at me, John, like I'm speaking a foreign language. They go, what are you talking about? I just got PRP, like all PRP is the same. And then I ask them, how much blood did they take out? How many times did they spin it? What was their X multiple? All these questions that we factor into it. And they had no idea that PRP could be different, or stem cells could be different, or Shockwave could be different, right? And I think that's been the biggest barrier. And if they're not covered by insurance, that's another component. That's we could have another whole discussion about how insurance coverage limits really good care and in that regard. But that's usually the biggest objection, John, more than anything else, is the educational component, that not all PRP and not all stem cells, not all Shockwave, not all these treatments are the same. I give this one example, that people are wanting to get into the regenerative medicine game, quote unquote. And they come up to me when I speak nationally at conferences, and they're like, well, how do I get better? And how do I get into this regenerative medicine business or this game? And I said, would you ask someone, how do you get into the baby catching or baby delivery business? Like, do I just get some sticky gloves? Is that all I need? Like, just, does the baby pop out
Yeah.
and I just catch it? Right?
20-minute
Or how do I
video
get,
and you're done.
yeah, right. It's like those old Holiday Inn Express commercials, right? We're like, oh, I don't know what I'm doing, but I watched, I stayed at Holiday Inn Express, and so same thing. Like, but how do I get in the orthopedic surgery business, and how do I get in that game? And part of that is there's training involved, right? And I think that's the challenge for the general public, because anybody can go get a PRP kit or say they do PRP or whatever, and people just don't know the difference. And this is why when you reached out, I said, I'd love to be a part of this, because it's an educational component that if you're looking for these things and paying for things out of pocket, you certainly want to go get the best, right? And I think that's something that I think people should know more about.
How do you break that down for patients in a way that's kind of like I talk about, like in a Pixar type fashion, where it's like anyone can understand what you're talking about instead of talking to like PRP and these other acronyms? How do
Yeah.
you explain that to someone so they get it like that? Like, what's a
So
fast way to do that?
fantastic. So I use protein powder as an example, right? Or if you're supposed to take 2 scoops of protein powder, but you only take a teaspoon and then you drink it and it doesn't have the desired effects, is it the protein powder didn't work or your protocol didn't work for taking it?
Yeah.
Right. And the other example I use is we use ultrasound so we can directly visualize where we're putting the needle. Right. If you're playing pin the tail on the donkey and you have a blindfold, are you more likely to hit where your target is with the blindfold on, or if you don't have the blindfold on?
Yeah. That's an easy
So
way
the
to
two
think
pretty
about it.
simplistic
Yeah.
answers, right? I mean, in terms of that's literally what we're doing is you need to have the right protocol and then you need to be able to see where you're going. Above all else, you need to make the right diagnosis, right? And that's the other component that if your, the other, we talk about a diagnosis. If your refrigerator is broken, but you're fixing the microwave, is that going to fix your original problem? No. So those are the 3 ways that we sort of talk about it where they're like, huh, that's right. Maybe my diagnosis was incorrect. Number 1, maybe they couldn't see where they were going because they didn't use an ultrasound, which is standard, which should be standard care. And then 3, maybe they just didn't use the right protocol, right? And then, and we talk about the aftercare and all that. Well, if you broke a leg, would you go run and play in a game the next day? No, you would take care of it, right? So why is it a little bit different when you're getting an injection and trying to recreate the injury, if you will, from a regenerative medicine standpoint? It sounds so simple right? I mean, it sounds so simple when I put it in that term. But yeah, I think that's where it gets a lot of people.
Thinking about bigger lens, like the industry, is there a myth out there that needs to be debunked when you're working with your patients that just doesn't make any sense, or you keep hearing again and again, that you want to provide some education on?
Yeah, I think the biggest thing, I touched on it earlier. If you're price shopping for your biologics, your PRP stem cells or shockwave or whatever, be very careful because you should do your homework on why things are cheaper. We talk about this, like we're not the most expensive, we're not the cheapest. We feel like we value our work fairly. We're not trying to squeeze every dollar out of everybody. The component is doing your homework and asking these questions that can absolutely delineate who knows what they're doing and who doesn't, or who's doing substandard work or who's doing exceptional work. And I think those are the components. So the biggest message out there that I would tell everybody, that not all PRP, not all stem cell, not all shockwave treatments are the same, and to really, really seek out leaders in the industry that are doing it, that are teaching it, that are on the other side of the table, not just simple end users of products that actually are helping design protocols or helping to teach. And I think that's really huge. Yeah.
And when you're maybe working with a particularly difficult patient that is encountered in every practice, and you feel like you're saying all the right things, but it's just not going through, how do you really work with those patients, try to do what you can?
Well, yeah, John, it's a great question. I mean, I often talk about this, that the benefit of being a subspecialist is that nobody's going to hold you down and force you to do anything.
Yeah.
Right. I tell them, I said, look, like, you came here for my opinion. Here's what I would do if you were in my family. You could walk out of here and say, Garg's crazy. He doesn't know what he's doing. And I would be fine with that because I always say, like, we're all big boys and big girls. And so think if it doesn't fit you, that's okay. Right. I mean, at the end of the day, the thing that drives me is, have I explained it to them in a way that they understand it, right? As we talked about, like I want to make sure I try to teach at a 5th grade reading level, so that way I can capture everybody I can. And then if they want to ask more in-depth questions, now we've established a baseline. And if it doesn't work for them, it doesn't work for them. And that's okay, right? I mean, our clinic is filled day in and day out with 2nd, 3rd, 4th opinions. And oftentimes I'll ask and I'll say, has anybody ever looked at this with you? And they'll say, nobody's even mentioned this, or nobody's even checked me in this way. Or we do a dynamic ultrasound and I show them the images on the screen. And I say, does this make sense now? Does this hurt where you hurt when you hurt? And they're like, yeah, that's exactly where I hurt. And they can see the gap if there's a tear, or they can see the thickening on the ultrasound. They go, okay, I'm validated that there's reason to have pain here. And so I think that's the biggest thing. And at the end of the day, if they decide not to do anything, then they decide not to do anything. I think the choice is, I think there's always a choice here, John. And there's always a cost involved. I had a woman yesterday who said, I can't go up and down stairs. I can't play with my grandchildren because I can't get on the floor. And so we were talking about options, and, we talked about certain things that would be beneficial for her. And, when it comes time to the investment, I said, look, it's really up to you. There's a cost either way. So how much do you value going up and down stairs pain-free? How much do you value playing with your grandchildren? And then you make your decision from there, really. I mean, I think that's been the biggest thing. And so we did a little bit of a mini treatment for her, and she said, this actually feels really good. And I said, this is a very truncated treatment. You can tell we're targeted on the right spot, and we're going to be able to do some good work here. And I think at the end of the day, you just have to feel really comfortable about what your decision is.
Yeah, and empowering them, right? That's a lot of it as well.
Well, you
It
have
sounds like,
to.
yeah.
You have to, right? I mean, it cannot be a dictatorship. It doesn't matter how good you are from a procedural standpoint or whatever. If they're not bought in, it's not going to matter.
Yeah. And another question I had too is like, there's always like uncomfortable truths with every specialty or, provider I talk to. Is there one specific to like sports medicine or regenerative orthopedics that, people don't talk about, but maybe they just need to say it out loud? It might be in their brain, but just no one's has it in discussion.
Yeah. Rest is usually the wrong answer would be the big thing. And so that's one big thing, that it's different if you're augmenting your athlete's training so they can do different things while you're resting and recovering, or I shouldn't say resting, you're actively healing the injured area. A lot of times the old notion is, well, just rest for 6 weeks and you'll get better, or don't do this, and without any rhyme or reason. And I think that's really been the biggest thing. The other component to this, John, is the flip side of, sometimes I have to protect you from you. And I tell this to athletes sometimes, that they don't want to shut it down in one way. And I said, you've overtrained in one area and you've undertrained in another area. And now that overtrained area is injured. So we have to dial that one back so we can have you get better at the undertrained area. And so having them understand that dichotomy and being able to appreciate that, I think is huge. And so that's been the biggest thing. The biggest notion is that for me is rest usually is not the right answer. And then to me, the old system of let's do PT, let's do a steroid shot, let's do an injection is really treating symptoms rather than going after the diagnosis, right? And another one is ice and anti-inflammatories will cure everything. Now, if you take that out of context, then that's a pretty good soundbite. But if the challenge with ice and NSAIDs like ibuprofen and things like that is, those are anti-inflammatory. Those are really managing symptoms, right? If you look at PRP and stem cells and shockwave and things like that, those are pro-inflammatory responses. I want good blood flow in there to help you to heal faster. You're taking Advil or you're taking Aleve and you're putting ice on it. That's to manage your symptoms. That's really not doing anything to help you heal. We take it on the other side, that we want actually to get out the bad inflammation and put in good inflammation. And that's the key component to help you heal faster. The corticosteroids work the same way. Corticosteroids are a potent anti-inflammatory. There's been numerous studies that show that corticosteroids are damaging to your joints when they're injected. So that's a very old school way of thinking. Well, we'll just put a steroid injection, see how you are. I'll see you back in a couple of weeks. If you're not better, then we'll send you to therapy. And if you're not better there, we'll send you to surgery. By that time, if we're going the route that we do, they're back doing their things that they want to be able to do, right? If their recovery is 3 months and we're getting people back to start to do their work in 6 weeks, I mean, without surgery, right? I mean, that's the other component. So that's been the biggest thing there.
And looking, at your practice as well, because I know a lot of people were probably familiar with like going to their doctor's office, which may be like internal medicine or, maybe like a pediatric office or something, but regenerative medicine is a whole new space to a lot of people. How does your business work, and like, how does that look from the inside when you're working with your patients?
Yeah, really everything for us has been built around the patient, really patient centric. It starts even when you walk in. I mean, every new patient gets to pick what music we listen to in the clinic. I mean, something really small like that, where this place should feel where it's warm, safe, inviting, and a good place to heal. And so we spend an hour with every patient because for us, we're trying to again reverse engineer what happened so we can make an impact there. And so when we talk to them, we sort of go over what's been done, what they've tried. We do the exam, we look at imaging, either they've brought in an MRI or we're doing the ultrasound. And usually by then we have a really good idea. Even off the history. I mean, I'll tell you, it's when I teach students, a lot of times I look at their age, I look at how they walk in, and I see where their injury is. And usually you have a pretty good idea based on some of those factors of what's going on. And then that allows you to dive in deeper. And that's really been the biggest thing. So if you don't have a really good game plan going in, then I think it prevents you and you become less efficient as you go through the exam. And then the reason we spend so much time with everybody is that then we're able to see whether or not either we're starting the treatment right then and there, or we are doing a little sample treatment to confirm this is what we're doing, but also allowing the patient to sort of see what that feels like. But that's the goal, is how do we get you back as quickly and safely as possible using these technologies or the devices that we have, if it's appropriate. And I think that's always been the biggest thing, is are we doing things for the right reason? And that's what our goal is always. Like, is this the right path for this person? And I think that's it. And that's where the feedback that we get in our clinic is, you've given me hope. And John, this is before I've even touched them, right? Because I talk to them and let them explain to sort of what they're going through, and they say they feel heard. And we talk about options that could be available to them, and they feel hopeful. What's better than that, really, right? I mean, being
Yeah,
able
that's the goal.
to provide hope and to hopefully carry that out. So that's why I think our clinic, we had to double our office space in 6 months just because we were getting busier. I mean, it was
Yeah,
and
that's
having
that's amazing.
yeah, and having come out to Boulder, Colorado, and we didn't know a single person, like from a network standpoint or anything like that. Like, we didn't know anybody, and everything's been built on community support. And I think that's been the tremendous aspect of it, because it feels really good when you're making an impact in the community and it's supported by the community.
And how has your practice adapted to things like AI? That's like a huge topic right now, but no one really seems to have like a real good way to use it per se, outside of like ambient listening and notes and some other solutions. But have you been thinking of ways of how to use it? Are you using it today?
So we use AI every day in our clinic. And a lot of it is, how do we improve our efficiencies, right? And so it could be even in some of our protocols. And I look at and say, is there something that we're missing here that we're not seeing that we could add to it? Is there information that we should pull, that we should enhance what we're doing? Is it something on our website? Is it something on a blog post? Is it something on our patient communication? So we use it every day in our clinic. And I think it's been really helpful for us to give our patients a complete sense and a complete understanding of what we're doing. And I think that's been tremendous, because for me, it's about using the artificial intelligence to enhance your efficiencies. I mean, I think it's really important that when somebody calls, that one of our staff picks up the phone. I mean, that's a huge thing. Could we have an AI receptionist? And I think from that standpoint, there's components where you can mix both, and I think that's fine. But there should be a personal touch, and I think that's why we are successful. We don't pump 50 patients through our clinic in a day, and people don't feel like a number. Like I said earlier, we build relationships first and foremost, and then we take care of people second. And I don't really know any other way. And I think that's part of it. And that's how the AI component we've used to help us enhance that, take away the relationship component to what we're doing.
Yeah, and I've heard of other practices, they use automation like text messages with patients for follow-ups, especially with like maybe you had a procedure or surgery, with things to check up on. Are there things like that you're using today, or how do you follow up with your
Absolutely.
patients?
Yeah,
Yeah.
absolutely. Patient communication is huge in that regard. And that's certainly part of that efficiency component. So the reminders about the appointments or follow-ups and things, because we want to reduce no-show rates in general, not because from a financial standpoint. It's more of, hey, we've got a protocol in place and we've got stepwise approach to this. It's really important for you to be a part of this. And life happens and people get busy and totally understandable, but that's where I think the reminders are super helpful. And that's been tremendous for us to keep our patients and athletes on track so that way they can accelerate their recovery. And I think certainly post-procedural component and all of that, it's super helpful. And I think that's where you can make a big impact, because we've seen people in our clinic for second opinions and they'll say, I've had PRP. And I said, okay, well, what was your follow-up like? And they said, I'll see you back in 2 months. And I was like, I think we do things differently here. I mean, we keep a tighter hold on them post procedure and being able to be with them throughout their recovery journey. If it's taking other places 2 months or 3 months to get people back to doing what they want to do, and we're getting them back in 6 weeks. I mean, I think that's why we try to do it in that manner, because there's buy-in from that patient. They have a good understanding. They're going to get to work when they're ready to get to work. And I think that's been very successful for us in that component, and certainly a bright spot for our patients.
Yeah, because it's better than kind of hoping and praying they're okay for that 2 month period in between, right? Is like there's
Yeah.
so many bad things that could happen in those 2 months, and then you come see them again, and you're back to square one because there wasn't protocols followed, or they didn't get that right education to maintain what you did, and they've undone it, unfortunately. So
Yeah, I mean,
yeah.
you're spot on. I mean, that's 100% correct. We saw a patient who had PRP injections and was playing in a lacrosse tournament a week later, and they were like, it didn't work for our son. And I said, I hate to tell you this, but if you're getting that PRP injection in that area, and you don't know that it's going to be a little bit of a challenge. I mean, I think this is where in season we do things differently than out of season, right? And I think that's the other component too, John, is that like either you take care of athletes or you don't. There's not sort of this middle ground. I think it's, you don't just kind of take care of athletes. And I think part of that is, even from my background of playing college sports, playing a year of semi-pro baseball, coaching, and really being in the locker rooms, working with the national teams, being in the room with high-level athletes. There's a different mentality, right? Just inherently, there's a different mentality of that's what's allowed them to get to high levels. People just have the talent, but they also have a different mentality. And I think you have to work alongside them and be a team with them, where you eliminate this doctor-patient hierarchy. It's just two people trying to figure out how to get you back faster and quicker and safer and all that. And of course it takes my entire team in that regard. But I get to the point of there has to be that buy-in in order to take care of the athlete in anything. It could be in business, it could be in relationships or whatever. There has to be the buy-in that, am I in or am I out? A lot of things that are gray areas, and I get it. For us, that's a really binary thing for us. Either it's a yes or it's a no. If it's kind of, then I tell them I'm not your guy, because that's not where either, because I'm fully committed to you, right? If this is a path forward, I'm fully committed to you in this 100%. I need that back in return, because then, John, if it doesn't work, it doesn't work, but it's not because we didn't try. It's not because we didn't know what we were doing. It's not because we didn't do the right physical therapy or we didn't get pushed. Then it just simply didn't work, which sometimes it happens. But it eliminates extraneous factors and confounding factors if we're committed and we're going about it in a consistent manner. So I think that's vitally important.
Yeah, setting the expectation in a way is like, yes, I will help you, but I also need you in the right mindset and follow the protocols. So don't get right into the game the next day after I just did this procedure and then expect a different result, like a positive result.
Yeah, and I think in fairness, but it's laying that out there so they know, so they can make that decision, right? And it may not be right for them. And I tell them, I said, we've had basketball players that they're in season. We don't do this in these types of injections, because if I want to be able to do them right, then we have to follow that post-procedure protocol. So we do other things in the season to get them through the season and to be able to maintain that where they're able to contribute and play. And then once the season's done, hopefully after a championship, then we can get to work on the other side of it. And so, but that goes back to the same thing is whenever patients or athletes come into our office, one of the questions is, what am I trying to get you ready for? If they say, well, I want to run the Boston Marathon next year, I say, okay, here's our timeline. Here's how we're going to go. And then I ask, how much time do you need to prep for this? Or how much time do I have that I can do what I need to do? And before you need to go and prep and to be able to be successful in that regard. And that's how we work it, where sometimes they'll say, I have 4 races that I need to run. I said, well, okay, well, rank them in order of importance because you may not be able to do all of them because we have to figure out what's going to be in your long-term best interest and success rate. So that's really the big thing. But a lot of it is expectations. I mean, I joke around a lot. I say, we try to set very low expectations so nobody gets disappointed. But I think that's where it really comes down to the understanding. Do you understand what we're saying in a way that you feel comfortable, that you can go home and you can explain that to someone? And a lot of times when we see patients, they can't do that when they've been other places. And that's a really big area of importance and emphasis in our clinic is the educational piece. We draw out pictures, we write out things. We want to make sure that they really, really understand it because to me, that's how you get the buy-in.
And specific to the regenerative medicine space, like how do you visualize that for them? Like if they're just really not grasping it, not because of lack of effort, they're just struggling with it. What is like that last thing that you do to like really get your point across?
Yeah. So I always have a postcard that I draw out, what does Shockwave do? And I draw pluses and minuses and I draw arrows so they can follow with me. I draw, very, very rudimentary designs and drawings so that way they can follow along with me. Right. And I think that's been the biggest thing is how do you break it down into something that's manageable? And when we're talking about PRP, you say, look, we're taking blood from you, we're hyper concentrating the healing factors, and then we're injecting it precisely where you're injured. I mean, that's exactly how I say it to someone, right? I don't get into the platelets and whether or not it's leukocyte rich or leukocyte poor or what's and then we talk about the concentration and some of those things. But ostensibly, like at the surface level, that's what we talk about, that we're hyper concentrating the healing factors and injecting it to where you hurt. Then we look at stem cells. That's a more potent healing factor subset that is stronger than the PRP component, or it has a thicker viscous-like substance to it, which creates a scaffolding, which allows me to sort of almost create a blood patch, if you will. And so that's how I explain from a stem cell standpoint that if the stem cells essentially are just a much, much stronger version of PRP, right? And then that's how you describe that. If you talk about the shockwave and you talk about how it's sound waves targeting the injured area, where if you're doing it correctly, you don't feel it on non-injured areas because the sound waves will pass right through. But if you're on the right area, you'll say, yep, that's exactly where I hurt when I hurt. And so, that's the example that I use for the shockwave. And then for the exomind, we talk about imagine from a mental wellness side that you're on a 2-lane highway or a 2-lane road stuck in traffic all day. And you just feel like you can't get that free-flowing energy through there. And after the exomind, one of our athletes said, I feel like I'm on a 10-lane highway. Everything's easy going. All my stress has sort of melted away, and I can focus now on my training. That, when people ask, well, how does it do that? I said, well, it's transcranial magnetic stimulation. So it's electromagnetics that's stimulating a certain part of your brain that is creating stronger neural connections. So when we're on our phone or doing things that are sort of mind-numbing, if you will, that it decreases the strength of the neural connections. And what this device does, it helps increase that strength. So you get to be able to have more clarity and to be able to decrease brain fog and to be able to do some of these things that medications can't help you with and therapy can't help with. So this becomes a structural enhancement of your neural connections. And so that's the way that we try to describe things. And then even for the pelvic floor, same thing. If you tell somebody, have you ever tried to do a Kegel contraction? And they're like, yeah. And then imagine doing over 10,000, 11,000 of them in less than 30 minutes at a super maximal contraction rate. They don't quite grasp it, and then they sit on the chair fully clothed, mind you. A lot of pelvic floor therapy is really invasive and really
Yeah.
intimidating. We have this device that we couple with the Shockwave, which, John, no one in the country has the things that we have in combination that we do in our office. And it just happens to be a byproduct of us just having the biotechnology in there. And sitting on that chair, and they can feel it targeting areas that they've had such a hard time stimulating and working on. So that's been the biggest component for us, is how do we bring in things, and I think we've done a good job with that, where we can now take care of the athlete from head to toe.
Yeah, it sounds like you made massive strides in this area, kind of combining different pieces and devices to accomplish many different solutions for your patients in your practice. Getting into the vision, where do you want to go with this? So like in 6 to 12 months, and in 6 months, you've grown already so quickly, increasing office space. But like, what's your longer term vision?
Yeah, we've built an infrastructure in place where we wanted to make sure that as we continue to get busier, and as our name continues to become more prominent, and it's, can we handle it and create an infrastructure where we don't decrease our product, if you will, right? And so I think sometimes when people scale, there's an inherent drop off in the quality of what you're doing. And I think that's really important to me, is that this is a customer service industry. I mean, and this is part of understanding that component. So for us, the big key is that our clinic has been continually evolving. We didn't actually, if you ask me, we're in year 3 right now. If you asked me 3 years ago when we first moved out here, September 28th, 2022, we packed up our car and just moved out here, stayed above somebody's garage, lived in Airbnbs for 3 months, just did some scouting work to see if we could make a difference. And we felt like we can make an impact. But if you told me at that time that we were going to have a mental wellness device and a pelvic floor device in our clinic, I would have said, there's no way. That's not part of what we do. This is part of that evolution. Our athletes were asking for, hey, do you have anything for pelvic floor? Because I want to get better here. We have a lot of female and male athletes. And that's the misnomer too, that the pelvic floor is only for female athletes or postpartum females. That could not be further from the truth. And so we looked at this, and I went to a conference, and I called Nicole, and then I said, I hate how much this is making sense for our clinic, because I don't want to spend more capital on equipment, but I don't see how we don't bring these machines into our office, because now it's a complete regenerative medicine for the entire body in a way that no one in the country is doing what we're doing. And I think that's been the thrilling part. So in the next 6 to 12 months, we have the infrastructure in place to continue to handle the demand of elite level, industry leading orthobiologics with the PRP and stem cells, and industry leading shockwave components. Because the other thing too is that there's a lot of misconceptions about shockwave. People say that they have this one device and they call it shockwave. It's actually radial pressure waves. It's not even really shockwave. And then we use another electromagnetic device that enhances that shockwave component. So in the next 6 to 12 months, we look at this and saying that we know that we are first and foremost doing things for the right reason, and looking at it where, what can we do in the patient or the athlete's best interest? And then do we have the infrastructure in place to carry that out? And so the answer to both those is yes. And that's been the biggest component, that I don't have a desire to have a dynamic athlete in every single state and to take over the country in that regard. We're good in where we are. We want to be a resource for the community and continue to serve in that way, because it's really, really special when you get to have a patient or athlete that gets to be able to do what they want to do, and they've been stuck for months or years and they haven't been able to do it. We had a woman who she had a tear in one of her tendons in her hip, and we used the stem cells to help repair that. And I remember her saying, it's the first time I've been able to play with my grandkids in years, over Easter. And so it was just phenomenal. Like, that stuff doesn't ever get old. We had a woman who had breast cancer, who had a lot of fibrosis in her arm and had difficulty raising her arm. We did a little bit of work with her, and she was able to lift her elbow above her ear. And I said, when was the last time you were able to do that? She said 7 years ago.
Wow, that's a transformative experience, I'm sure.
I mean, our group was over the moon, and I was like, you guys, I mean, every time this happens, we get excited. And it's not because we're surprised, it's just it never gets old for us. I mean, it happens on the daily here, John. I mean, that we see these things and they look at us and they get tears in their eyes and they're like, I've never felt anything like this. And it's been years since I've been able to do that. And I think we put a lot of work on the front end to be able to make sure we're doing things for the right reason, we're targeting the right diagnosis. And then the rest of the stuff is it's pretty straightforward. Then we just put the work in because once you have the diagnosis and you know what you're hunting and you know what you're going after, and I think the rest of it is just putting the work in. So now we've got a plan. Now let's just put the work in and let's get you back. And I think that's been really the cool part. And I think it's been a place where people feel related to, and they feel like, I mean, look, I always say this, that like I look better on paper than I really am. And I always joke about this, that like if you look at like Yale resident and Andrews fellow and a 2-sport US national team doctor, usually gets me in the door places. And then you have to kind of carry yourself in the way that you are after that. And I think that's been the biggest thing, is that despite, and I'm super proud of all the training and where I've gone, but at the end of the day what is your ability to create those relationships and then to also do good work, right? And I think that's really the big thing too. And that's what's been driving us, is how do we get better every day? Even, we've done these procedures thousands of times, and even every time we're like, okay, is there something that we could tweak a little bit? And it could be something small, like, I think I want a different drape and here's why. Let's try this because this might make us more efficient in that regard. Or let's look at using a different syringe here because I like the pressure feel of this. So that's what we do internally to try to improve what we do. I say this all the time. We run our office like a NASCAR team. Everybody's got a role and everybody's got coverage where they don't feel like they're on an island by themselves. When you come into our office, you're not just getting taken care of by me. It's our PA, our clinical coordinator, our medical assistants. So our clinical assistants, I should say, not medical assistants. And so even our students. I mean, when we're doing a procedure, our patients look around. They go, "Oh my gosh, like why is everybody in here?" And I go, "Everybody has a specific role to do this as efficiently as possible," and that's what we end up doing. It feels like they're being taken care of by a team rather than just one individual, and they feel it from the front desk, from our practice manager. So everybody is involved in our athletes and patients' care, and to the point where they feel like they're part of our family.
Yeah, and truly be heard, like you said. And as we're at the end of the podcast now, for people to really understand your work even more, I'm just thinking I got a really good glimpse at it today. What's the best play to get in touch with you or learn more?
Yeah, the best thing, go to dynamicathlete.com. We've got a form there that'll walk you through. It'll say, I've got knee pain, or what am I interested in healing? I have knee pain. Great. Is it acute or chronic? What have you tried? What are you interested in? And then you'll fill out some information and we can have somebody reach out to you and get you in our office and see if we can start that healing journey. And I think that's been the biggest thing. So dynamicathlete.com has everything that you need, and we'll explain to you how we're different and why we're doing what we're doing. And I think that's the biggest thing more than anything else. And if we can help you, great. If we can't, then we will find you somebody that can. And I think that's been the biggest thing. But at the end of the day is finding out what you have, why you have it, and what we're going to do.
Yeah, and I love that approach too, is like you may not have all the answers, but you'll point them in the right direction as well. So thank you for your
absolutely.
genuineness.
You have to, John, right? I mean, you have to.
Yeah.
So yeah. Thank you for having me here. This is I love what you're doing, and I'm honored to be a part of it.
Well, thank you for your time, and it was a wonderful discussion.
Thanks.